Sir, what's your name?
William Russler.
I'm Manav HPI, Dr. Manav HPI. I'll be taking care of you today. So can you tell me what brought you to the office?
Yeah, so I just had a box of books, and as I was moving up to my apartment, and dropped it on top of my big toe.
Your big toe on your left foot?
Yep, correct.
Alrighty. And so did the pain and issues start occurring the moment you dropped the box?
Yes.
And could you point out the exact location of the pain to me, please?
Yep, right there.
So near the tip of your big toe.
Correct.
Would you say this pain has been continuous since the injury, or
Continuous.
okay? And what about how would you describe the pain? What words would you use?
It's sharp pain.
Any burning or stinging?
No.
Is there anything that makes the pain feel worse?
Yeah, like walking and having shoes and socks on.
And then is there anything that makes the pain feel better?
Yep, just having my foot propped up with no shoes and socks.
Does the pain move or radiate anywhere from the big toe?
No.
And just to make sure this injury occurred when?
Yesterday at like 1.
And then on a scale of 1 to 10, how bad would you say the pain is?
6 to a 7.
All right, now I'm going to ask you some stuff about your past medical history. Do you have any history of hospitalizations or surgeries?
No.
Have you had any serious illnesses or illnesses at all in the past?
No.
Are you up to date on your immunizations?
Yes.
Do you take any medications?
No.
Are you allergic to any medications or anything at all?
No.
Have you had any transfusions in the past?
No.
How is your emotional state today in the office?
Great.
Awesome. And now I'm going to ask a little about your family. Or is there any history of illnesses or issues in your family from your mom's side or your dad's side?
Yeah, my dad's side, high blood pressure.
Who on your dad's side?
My dad.
Your dad had high blood pressure.
Yep.
Okay. And now next I want to go a little bit of your social history. So are you sexually active? If so, with how many partners? And do you guys practice safe sex?
Yes, and 1.
How much sleep do you get in a day?
I'd say 6 to 8 hours.
Are you satisfied with your sleep?
Yes.
Do you use any tobacco or vape products? Do you smoke at all?
Occasionally.
Now, what do you do for work?
I'm a student at Miami of Ohio University.
And do you have any exercise involved in your daily practice?
Yeah, like 5 to 6 days a week I work out.
Okay. And do you have any illicit drug use either currently or in the past?
No.
And what about your diet? How much food do you get?
I get 3 meals a day, relatively clean.
Okay. And then do you have any use of alcohol right now?
Occasionally.
How many drinks a week would you say?
Probably like 2 to 4.
Okay. And then do you have any pets in the house?
No.
Are you married?
No.
And have you left the country at all at any point?
No.
Okay. So I'm going to go ahead and begin the physical exam part now, and I'm going to be starting with the vascular exam. So the first thing I'm going to be doing is checking for your pulses, starting with the posterior tibialis pulse behind the medial malleolus. Okay, I can feel that pulse on a level of 2 out of 4. Next, I'm going to be checking the dorsalis pedis pulse. Okay, I feel that at a level of 2 out of 4 as well. Finally, I'm going to be checking your popliteal pulse. Okay, that is also at a level of 2 out of 4. Now I'm going to be checking the temperature. We're going warm to warm to warm here. Next, I'm going to be checking for your skin elasticity. Skin returns back to completely normal. There is no abnormal hair growth or changes here. And so final thing I'm going to be doing is putting on some gloves and checking your capillary filling time in each one of your toes. Okay, we're going to start with the right foot. The big toe here. Okay. Third toe, fourth toe, and fifth toe in the right foot. Now with the left foot, this might hurt a little. I'm sorry, I'm not going to try to affect the area. Good. Second toe, third toe, fourth toe, fifth toe. No abnormalities noted in terms of capillary filling. Next, I'm going to be taking a look at your skin, starting from the knees down. So the dorsal aspect of your right foot, no abnormalities noted here. Now your leg, now I'm going to go towards your foot. Same thing, nothing here. Now let me check the plantar aspect. Nothing noted here. Going to the plantar aspect of the foot. Everything looks good on the right foot. Now let me check the left leg. No abnormalities noted. Let me check the left foot. Up here near your big toe where the injury is, we see some redness, a little bit of discoloration due to bruising, evidence of injury. Other than that, everything else looks good here. Let me check the plantar aspect. Okay, nothing on the leg and nothing on the foot besides a little bit of bruising at the tip of your toe. All your nails look good. There is no evidence of any dryness anywhere on your skin or anything in between the interdigital spaces. And no pigmentation that is hyperpigmented whatsoever. And so now I'm going to be doing the musculoskeletal exam to kind of see how the strength of your muscles are. Just please push against my hands to start moving up, now down, now internal, and external. Okay, fantastic. All muscular strength looks good on that end. I'm going to check in the range of motion now for each of your joints. Starting with the first ray on the right foot. Okay, then that looks good in the first MPJ. Full range of motion there. Next, your subtalar joint. Okay, then finally your ankle joint. Okay, now I'm going to be checking your ankle joint range of motion with your knee bent to complete the silver skull exam. All right, so we get more than 10 degrees of dorsiflexion when your knee is flexed, but less than 10 degrees of dorsiflexion when your knee is extended, indicating some gastroc tightness in your right leg. Now we're going to go ahead and look at your left one. So I'm going to start with the first ray. Then I'm doing your first MPJ. This might hurt a little, I'll avoid the injured area. Okay, and then I'm going to be doing the subtalar joint, range of motion. We have full range of motion on both subtalar joints. And finally, the ankle joint into the silver skull exam. So I'm dorsiflexing the ankle joint along with checking the full range of motion. Okay, next I'm going to ask you to bend your knee. I'm going to be dorsiflexing here, just relax, all right? So there's presence of greater than 10 degrees of dorsiflexion when your knee is bent again. So we're going to have some gastrocnemius tightness, presence of gastroc equinus. Okay, so finally I'm going to be doing the neurological section of the exam. We're going to start with this Siamese Weinstein monofilament. Just please close your eyes and tell me when you feel sensation and when you don't. So starting with the first big toe on the right foot.
Yep.
Third toe.
Yep.
Fifth toe.
Yep.
First MPJ.
Yep.
Third MPJ.
Yep.
Fifth MPJ.
Yep.
Medial aspect of the
Yep.
foot. Lateral aspect of the
Yep.
foot. The heel.
Yep.
First inner rib space.
Yep.
I'm going to be doing the left foot now, starting with the first toe,
Yep.
third toe,
Yep.
fifth toe,
Yep.
first MPJ,
Yep.
third MPJ,
Yep.
fifth MPJ,
Yep.
the medial aspect of the foot,
Yep.
lateral aspect of the foot, and the heel,
Yep.
and the first inner rib space.
Yep.
Awesome. Next, I'm going to be doing sharp and dull sensations, so please let me know on either feet when you feel sharp and when you feel dull.
Sharp. Sharp. Or dull. Sharp. Dull. Sharp.
All right, we're going to move to your other foot now.
Sharp. Dull. Sharp. Dull. Sharp. Dull.
Okay, awesome. Now, next I'm going to be checking your vibratory sensation, so go ahead and have your eyes closed one last time for me, please. And just let me know when you feel the vibration and when you stop feeling it.
Feel it. Stop. Feel it. Stop. Feel it. Stop. Feel it. Stop.
Okay, now your left foot.
Feel it. Stop. Feel it. Stop. Feel it. Stop. Feel it. Stop. Feel it. Stop.
Okay, now I said last time, but we're going to have you close your eyes one more time and test proprioception. So please tell me which toe it is I'm moving and what direction that toe is being moved in. Starting with your right foot.
Okay. Big toe up. Down, big toe. Third toe up. Third toe down. Fifth toe up. Or that's fifth toe. Fifth toe up. Fourth toe up.
Okay, there we go. Now I'm going to do the same thing with the other foot, starting with, so.
Second toe up. Fourth toe down. Fifth toe up.
Okay, alrighty. So that is proprioception taken care of. Now we're going to be checking your reflexes. So just have your knees off the ground so you can check the patellar reflex. All right, that one is present. I'm going to do the other leg now. Okay, great. So both patella reflexes are present. Let's check the Achilles now. Just have your feet up off the ground. Extend them, and all right, we have plantar flexion there. Plantar flexion here as well, fantastic. The final reflex I'm going to be testing is the Babinski reflex. So just please have both your feet up. I'm going to go from the lateral aspect of the foot up to your toes. Okay. All right, so no fanning and dorsiflexion of the big toe present, so we don't, plantar flexion, no fanning present, the Babinski sign is negative. That's going to be the end of our physical exam. Now I'm going to go ahead and focus on the area of the injury. Here around the big toe on your left foot, we see evidence of some swelling, we see inflammation and redness, and we kind of see some bluish areas too, indicating bruising and some potential pathology internally. So what I think we're going to do for this injury is, the first thing we're going to have you do is leave here in a controlled ankle motion boot, a walking boot, and then with some crutches. So you're not putting any weight on this toe. Now I'm going to order some x-rays right now. And you're going to come back to my office in 3 days. So we're going to take a look at those x-rays to kind of see if there's anything going on in there. And if there is a fracture or any sort of bony issues, then we're going to have to ask you to be non-weight bearing for a few weeks. Whereas if there aren't any bony issues and it simply is a soft tissue injury, you can be slightly weight bearing, but in both worlds, you're still going to be using that boot for a good amount of time, and you might be using crutches as well. Along with that, I'm going to be prescribing you 600 milligrams of ibuprofen to take as needed with the pain, because I know it can be pretty tough to deal with. And so hopefully when you come back into the office, we get some good news, but either way, I think you should be good to go.
Perfect.
So that being said, thank you so much.
Thank you. Appreciate it.